Hey everybody, it's Dan with Pain for You. Gorgeous night. It's about 7:15 on a Thursday. You're going to see this one on Friday morning. Busy day. Just got done with some great coaching calls. Having a lot of fun with that. So, today's topic is going to be follow the breadcrumbs. And I'll tell you what that means in a minute or two. But we're going to take a couple of deep breaths, kind of relax a little bit, and kind of look at the woods, listen to the birds. Sun's going to set in about an hour. So, breathe in the confidence, breathe out the skepticism, breathe in the knowledge, breathe out the fear. Relax. So, follow the breadcrumbs. We all know the story of Hansel and Gretel, where they went into the woods and then they said, oh, we better drop some breadcrumbs so we know our way out. And of course the animals ate the breadcrumbs and they couldn't find their way out of the forest. So this has nothing to do with Hansel and Gretel, but follow the breadcrumbs is just kind of my analogy for saying, if we can analyze how pain happens and how it becomes chronic, we can follow the breadcrumbs to get ourselves back out of this chronic pain. Teach our brain, if you will, how to turn it off. So, pain happens. Sometimes it's an injury, a fall, a twisted ankle, a broken something, right? Pain happens. That's an injury, a true injury, right? An onset of a back spasm is not really an injury. That's an acute onset of TMS. If you've been following me for a while, you know what TMS is. If you don't know what TMS is, go to painforyou.com and watch the video there. I explain how pain happens, but I also explain how it becomes chronic. And we're going to talk about that because, again, how it becomes chronic is going to lead us the pathway out. So, pain happens. Let's say it's an acute onset of TMS. Right, major back spasm, big headache, migraine, first migraine, whatever happens. We got stomach distress, whatever it may be, and it persists. And it persists for a few days, so we start going to the doctor. We start getting medicalized. We start going from treatment to treatment, to doctor, to specialist to specialist. Oftentimes the treatments don't help. The prognosis is pretty grim. The doctors don't know what to do. They'll either see something on the images or they won't. And before you know it, we're medicalized. We have medical trauma from all of these treatments that do or do not work, or usually don't work. And we hear a lot of stuff that's kind of scary. And through fear, focus on the symptoms, and the anxiety about what this all means, the pain becomes chronic. Dr. Schubner speaks about in his book, Unlearn Your Pain, how these neural connections, these neural pathways can kind of keep on firing even though there's no physical reason for the pain. The original injury, if it was a true fall, break, or something, has healed long ago, but through fear, focus, and anxiety that you might not heal right, you know, we can literally teach the nervous system to stay in pain, right? And then it becomes kind of its own little monster, if you will, and we get worse and worse, fear-wise, anxiety-wise. We become desperate to fix it. We focus on the pain, focus on the pain, focus on the pain, and what happens, it becomes more and more connected. These neural pathways in our brain really kind of lock it in because we have learned this language of pain. And so, if we can learn this, we can unlearn it. And that's Dr. Schubner's whole brand, you know, Unlearn Your Pain. It's his book, it's his website name. But again, following the breadcrumbs, if we know how we got into this mess, we can figure out how to get out. So what does that mean? That's why I really, focus so much on the mindset, because if what makes it chronic is staring at the symptoms all day long, freaking out about them all day long, being desperate to fix them, anxious about them, fearful, angry, sad that we've got these darn symptoms and it hurts so much. That's what turns it chronic. So doesn't it make sense that the way out is to flip that response on its head and do the opposite? And that's why I say so much. Calm down, relax, you're not broken. You just think you are. So let's flip this on its head. If the fear, focus, and anxiety is what makes it chronic, what would happen if we lost the fear or turned it down, literally removed it through accurate knowledge about what TMS is and the fact that you're not actually broken? That's how we can turn down the fear. Focus is a choice. We can choose. Now that I know I'm not broken, I can choose to shift my focus away from the symptoms. And by lowering the fear, you're also lowering the anxiety and also learning to calm down your thinking. Let's not focus on and think about the pain so much, because we know it's TMS, it's just TMS, and I know that that's what it is, and I accept that. And so by doing the opposite of this fear, focus, and anxiety about the symptoms that turned it chronic, do the opposite, and you can unlearn it. And your brain will get the message that, hey, Dan's not paying attention to this symptom anymore, therefore it must not be important. Therefore, these neural connections that got wired when you made it chronic can start to let go and loosen up. And yes, it can be that simple. It doesn't have to be this lifelong struggle. I truly believe you're not broken. I don't believe you're broken physically. I don't believe you're broken mentally. We can become afraid of our brains. We can become afraid of our emotions, and that, well, if I get sad, it's going to make the TMS worse. And so we get totally frightened. But again, you're not broken. Emotions are just emotions. They have no meaning. So learn to feel them. Practice feeling them. It takes practice to get good at it. You got to teach your brain that you're not broken. Now physically, you got to teach your brain that you can handle these emotions. How do you do it? Repetition. But there is a good amount of knowledge therapy, which is what the heck is TMS and do I really have it? That assessment and accepting that deeply, like in your heart, knowing, deeply knowing you've got this. That brings you a certain calm and confidence and allows you to get to the attitude of indifference and shift your focus away from the symptoms. And it allows you to take the fear knob and turn it way down to zero. Because when you truly know that you're not broken, there's nothing physically wrong, you can turn down the fear and the anxiety, and you can shift your focus back to living your life. And so, literally follow the breadcrumbs. I just laid out the path as to how a one-time pain turns chronic. And by following the breadcrumbs back out and doing the opposite of what got you into the chronic persistent pain, the learned pain, turn it backwards, do the opposite, and you can unlearn this pain. And yes, it can be that simple. So, fear, focus, anxiety. Focus away from the symptoms. Turn down the fear with accurate knowledge. Anxiety is going to calm down because you know deeply that you're actually okay. And you're going to start learning to calm your thinking. That's part of the soothing. Just don't get yourself all worked up with these crazy catastrophic thoughts of this horrible future. So, follow the breadcrumbs out of the dark forest. Whatever brought you into chronic pain, the exact same path will lead you out. Just do the opposite. So, hopefully this was useful for you. Not a terribly complex thought process here, but I think useful to kind of view it that way. If what got you into chronic pain can be understood, do the opposite and you can get out of chronic pain. So, love you guys and gals. That's it for this video, and we'll see you soon.